Hello, I'm Charlie Englehart.
And I'm Scicluna, and this is our project on the problem with the Affordable Care Act.
As many of you know, the United States of America is looked at as the land of the free, when in reality, it is the farthest from that on the front of healthcare. In fact, the United States has the most expensive healthcare system of any country in the world, with millions of Americans uninsured and unable to afford it. For decades, policymakers have tried to bring reform to the system. And the most recent has been through the Patient Protection and Affordable Care Act, also known as Obamacare. So the act was passed on March 23rd of 2010. It was 2,500 pages long with over 500,000 words. And it has five key components. The act put out an individual mandate requiring every American to obtain health insurance coverage. It also put out an employer mandate requiring all companies with 50 or more employees to provide insurance, or they would have to pay a fine. It also put forth new insurance regulations, many of which were very popular among the public. Another component of the act was the health exchanges or marketplaces, which were designed to function as middlemen in matching customers with insurance providers. And lastly, the act's most principal mechanism for expanding coverage is to pay for it through government programs like Medicaid, the SCHIP, or through subsidizing private insurance. All in all, these aspects ultimately led to a major shift in the health insurance market that did not result in the outcome that was intended. So this first key component, the individual mandate, sparked a lot of controversy because it forced Americans to either purchase government-defined minimum essential coverage insurance plans, or they'd have to pay a fine that would come as a percentage of their annual income. So some Americans who were already satisfied with their current insurance plan still had to pay the fine or find a new coverage plan if theirs didn't set this government-defined minimum essential coverage. The constitutionality of the individual mandate has been debated, with some saying that is unconstitutional for consistently and unlawfully imposing rising costs on citizens and transfers an enormous amount of regulatory power to the federal government. While in 2012, the United States Supreme Court declared the individual mandate constitutional due to the government's right to tax, not an unconstitutional requirement that all Americans must purchase a product, since they have the choice whether to pay the fine or get the insurance that is defined as having minimum essential coverage. So either way, a healthcare reform act as massive as the ACA must entail no debate over its constitutionality if it is going to be good for all of America.
All right, to now touch on the coverage loophole within the Affordable Care Act. The ACA had allowed essentially for people to purchase health insurance and receive coverage right at the exact moment they needed it.
And as you can see from the diagram on the right, the insurance fund works by having a number of policyholders pay monthly dues in order to add money to the insurance fund so that when another fellow policyholder needs money to pay for these bills, it's available for them.
So to put this in perspective, essentially, let's say little Johnny had accidentally broke his arm, but he did not have, he was uninsured. So under the Affordable Care Act, he could actually purchase medical insurance after he broke his arm to help with the cost of medical bills. Now, this kind of went like, if this ability hurt the insurers, although it may have helped little Johnny and other people who kind of got to use this to their advantage, it in turn hurt the insurance companies because they weren't turning a much of a profit, as well as they weren't gaining a sufficient amount they needed to sort of stay alive in the business of insurance. All right, so another point that we want to make is that although Obamacare did have its great goals, it did not really successfully meet the demands. And what I mean by that is people, instead of wanting to pay for insurance. They just paid the fine that they would get as a result of not paying because it was cheaper than e- even the cheapest plans of Obamacare, which is kind of quite surprising. And some claim that the ACA decreased the rate of increase in insurance premiums. And what I mean by that is, although there was a slight decrease in like the rate at which insurance premiums are increasing, there was still an increase, and essentially insurance premiums were still at a high. So yes, it did have its, good effects, but at the end of the day, when you look at the numbers, that outweighs the benefits of Obamacare. To wrap things up, it would be a major discredit to say that what the Patient Protection and Affordable Care Act was aiming for was something that is not good for America. Because, as I said in the earlier slide, it did have its good goals. It's just the execution was poor and could have been better.
The ideas that the Affordable Care Act put out there and what it did put in place for America is showing that we're going in the right direction, although many of the outcomes of it are something that are things that were unplanned and unneeded. So I'm sure the future will hold for us new healthcare reform that can be even better and even greater and really get to a point where all Americans can feel safe and sure that they will receive the healthcare they need to live a happy and full life. So thank you guys for listening, and that is
Thank
all.
you.